All right, Dr. Ben Latto O'Brien, Doctor of Chinese Medicine and Nutrition from the Natural Medicine and Nutrition Clinic in Subiaco. Now, today we're going to talk about Acupuncture 101. I'm going to give you a little demonstration. People are a bit freaked out about needles and acupuncture. Does it hurt? Does it not hurt? No, really, it doesn't hurt, depending on, of course, on how it's done and who's doing it. I don't want pain when I have acupuncture, so I try not to do that to my patients. It's not ideal. So, let me explain. This is an alcohol wipe, and I actually think they've changed the laws now. We don't actually technically have to wipe points, but I was trained to do that last decade, so that's what I do. So, get my hand here. I'm going to wipe this with alcohol. Okay, I'm going to give that a minute to dry, and that's what creates the hygiene. So you wipe off the bacteria or whatever else could be on the skin, and you don't touch it again until you put a needle in. Now, this little thing I showed you before is a guide tube. So this is what we use as a tool in clinic. And this is just a plastic tube, and what we do is we get an acupuncture needle, and I've got one just here. Let me show you that. So that looks like this. It's just a tiny little pin, very, very thin. It's about the diameter of a human hair, super fine. I don't touch the shaft, I just touch the handle. I'm going to feed that in backwards, and you can see that the needle is a little bit longer than the guide tube. So it sticks out about 5 mil. So be careful with this. So hang on to the needle. Needle's in the tube, so I'm not touching the shaft of the needle. And all I'm going to do is I'm going to locate where I want to put it. I'm going to put this on my hand, and then you can see the needle sticking up about 5 mil above the guide tube. And I'm just going to tap it once, and it's in. Take the guide tube off, and then you can insert the needle to the depth that you want it. So this only goes in, I don't know, probably 5 or 6 mil, something like that. Not very deep. There's no pain, and you just sort of get a dull, heavy, achy sort of a sensation. Sometimes there can be a stronger jolt where you're activating the nerve, stimulating the brain, moving blood to a different part of the body. That's how acupuncture works. But it's very simple. Should be more or less painless, depending, of course, on who's doing it. I don't want pain, so I try not to do that to patients. And I'll get rid of the needle now. So, no blood. As you can see, sometimes points do bleed a little bit. Depends if you nick a vein or whatever, then they can bleed. This needle has now been used, and so I dispose of it. And you have to get rid of needles. We only use them once. They're sterile, they're single use, and once that's been used, then I put it in a sharps container, and it doesn't get used again. It gets melted down, turned back into a needle, and recycled, which is pretty awesome. So that is Acupuncture 101. We treat a lot of different health conditions in the clinic: headaches, migraines, period pain, pain in general, millions of different things. So if you want to learn a little bit more about what acupuncture can help you, get in contact with me. Leave me a comment, give me a call at the clinic, or just if you want to just ask a question, then you go for it. But acupuncture is safe and it's effective, and it's pretty awesome, the amount of conditions that you can treat in clinic. It's very, very cool. So hopefully that is a little bit clearer and you're not so freaked out about acupuncture now. It's nothing to be scared about. It's pretty cool. Any comments and questions? Thanks, guys. You let me know. Bye.